Hi everyone, I hope you're doing well. Today's video is going to talk about two very understated components of your musculoskeletal system. We're not going to talk so much about the muscles today. We're going to talk about the joints, joint integrity, joint health, and we're also going to talk about bone mineral density and how exercise and nutrition and lifestyle relate to these. Okay, so they're two very different topics, but I'm going to work them both into this video because they are fairly adjacent. I'm going to dive right in and just start telling you everything you need to know because there's a lot to it, okay? So bone mineral density. Now, when someone has osteopenia or osteoporosis, which suggests that bone mineral density is too light, there's not enough bone mineral density, we need to increase it. What we need to do in terms of exercise is gradually build your body, your joints, your muscles, all your structural awareness, everything that goes into exercise. We need to build that up until you can reach a point where the affected bones, let's say, for example, the humerus bone here, if this is a bone that is too weak, that does not have enough density, then we need to get to a point where the surrounding muscles can be trained to about 80 to 85% of their capacity. Okay, so think about that for a second. That means if the humerus bone here is too brittle, we need to train, for example, the medial deltoid here, the muscle that goes down here. We need to train that to about 80 to 85% of its capacity, also called a one repetition maximum, which just means what's the most weight it can lift one time through a normal range of motion. Now, what that means is when we're lifting a weight that's that heavy, or as compared to the muscle's capacity, we're going to be a lot more likely to generate force that's going to rebuild that bone mineral density if we do so regularly enough. Okay, once a week is usually not going to do it. We're going to need at least twice a week or more. So this is a really important thing to know, because what almost everybody does when they have osteoporosis or osteopenia is they're told to just take on more weight-bearing exercise, to lift more weights, to go for walks or jogs, and to do something that's a little bit more jarring to the bones. Well, that alone, I mean, that's a really high level, vague way to talk about it. And so what ends up happening is, yes, that can do a little bit of good, but if you're looking to confidently reverse osteopenia or osteoporosis, and that's what you should be wanting to do if your bone mineral density is too brittle, then you really do need to get to the point where you're gradually working your way up to a weight that's so heavy that with good exercise technique, good strength and resistance training technique, you can only lift the weight somewhere between 1 and perhaps 4 or 5 times. Generally, if you can lift it more than about 5 or 6 times, the weight's probably not going to be necessarily heavy enough to improve your bone mineral density. Now, please keep in mind, these are general terms. So this is what science has found, what the statistics have found. But you could be an anomaly who radically improves bone mineral density with a much lighter weight. That really could be the case. And I hope so, because it'd be a lot safer for your joints and for your other muscles. But clinically speaking, looking at the stats, you're probably going to need to get to a weight that's so heavy that you can only do it 1 to about 5, maybe 6 times or so at the most. And that after that, you're not going to be able to continue the exercise with great form without losing some range of motion, where you're only coming up part of the way, or where you start getting other kind of wonky movements. So this is the first thing you need to know about rebuilding lost bone mineral density, is that we ultimately want to reach that point for the affected bones. If you don't know which bones are affected, please try to find out. I know a lot of times people are just told you have osteopenia and that's it. There's no specificity as to how each of the bones scored, but it'll certainly help you a lot if you can find out exactly which bones are affected and which ones are not. Because, we're talking about some very heavy strength training here. And if preferably, you don't have to do any more of it than what's really necessary, that you don't have to start training your whole body with that kind of intensity, because that's a lot of work on the heart, on the lungs, on every other muscle and joint in the body. And you really need to be very well supervised to do that. Where hopefully you just have a couple of bones that really need this sort of attention. Keep in mind, nutrition is a whole other conversation about this as well. Obviously, calcium, vitamin D, there are so many components of nutrition that need to be properly addressed each and every day. But I think that's an easier conversation than this one we're having about exercise prescription. You need to work your way up gradually before you can take on these heavy kind of loads. And that means building every muscle in the body so that your posture can be just right, You maintain the proper curvature of your spine, that your knees can be bent if you're in a standing position so that you're not absorbing forces into the knee joints. There's a lot more we can talk about at a more private level. If you want to reach out to me personally, I'd be more than happy to chat with you, and we can start to formulate what's going to be the safest and best way to go. Okay, all that said about the bones, now let's talk a little bit about the joints. So joint adaptation is similar but different because we're not looking to really like build strength. With joints, it's about pain-free range of motion. So I'm using this little example here, I'm in my chair, of just circling an arm all the way around. The joints that make up your shoulder allow for all kinds of different movements. They allow for this kind of circle in front of you. They also allow for a circle off to your side. And we can get into all kinds of things, abduction and adduction and inside, outside movements, everything. And so what I'm getting at there is that if there's any failure at any point in any joints that make up the shoulder, that is potentially going to really lead to a lot of similar health problems. And what I mean by that is, let's say that you have trouble like this, horizontally adducting the arm, bringing it in like this, because you start to find pain or something like that along the way, pain or some kind of a limiting obstacle, right? And so you're trying to perform this movement and you're not able to do so comfortably and easily. That is going to tend to show up in the way you go about your life, in the way that you're doing things. If you're reaching up into the cupboard and moving your arm a certain way, you're going to start coming up with compensatory movement patterns. And that is going to just disable more and more of your musculoskeletal system as time goes on. You're going to start to get into really wonky kind of movement patterns where you're accidentally creating movements that really shouldn't be happening in that moment based on what you're trying to do. And so joint range of motion becomes critical to maintain. Now I can give you a lengthy list of how every single joint in the body should be performing, how far it should be moving, and in what directions it should be able to be moved and for how long. And when we do that just right, you preserve the pain-free mobility and range of motion of every joint. So for example, elbow. If the elbow is not able to fully flex and fully extend like this, if you can't do that, then potentially we have an elbow problem, which could very likely mean a muscular problem as well. And these are all things that can be normalized in most cases. There are a few exceptions out there, but in most cases, all of this can be normalized with the right exercise prescription, generally taking 2, 3, maybe 4 days a week, depending upon how much time you're committing per exercise session. Anyway, everybody, to really get some solid answers, we'll need to talk privately one-on-one. Go ahead and reach out to me. I want you all to know I'm here to help, and I'm already looking forward to your health and your wellness success.